Okay, so one of the most important thing that you need to do before listening part A starts is that you need to predict the type of word for each blank. And how do you predict that is with the help of context sentence and with the help of headings and subheadings that you have. So the main focus while you are preparing for a test like OET is to improve your prediction skills. The better you are at prediction, higher your score would be. So here it says you hear a GP talking to a patient. So this is a conversation between a doctor and a patient. Then presenting factors. So presenting factors starts with rash on chest. Okay. So layout of the notes taken can also be a very helpful factor while predicting, because see here you have a major bullet point, the bigger one, and these three are sub points. That means they all are going to be about the rash, right? So he would not be discussing in this part of the conversation, he would be just talking about the rash. So here it says pruritus, which is again one of the symptom of the rash. Then blank in appearance, and describes it as weird. So two important keywords you get here. One is blank in appearance. That means the word that you are looking for here has to be an adjective for the rash. Now you start predicting what kind of adjective can we have, right? We can have itchy rash, we can have painful rash, you can have appearance in terms of color, we can have appearance in terms of texture. So those kind of adjectives we are looking for. And the word weird is already given. So our answer cannot be unusual, okay, or nothing similar to weird, because weird has already been given. Then it says noticeable increase in number of. Again, it is in continuation of rash. Okay. So number of what? So here it is going to be a symptom. Then second heading says recent condition, and that starts with upper respiratory tract infection, cold, and blank 3 weeks ago. So here 3 weeks ago is your keyword, and the type of word you're looking for is a condition, because all these three bullet points are about condition. And you can see that here cold, upper respiratory tract infection, they are all about the other conditions than the rash, right? So this is not uh, anything about the rash. Then patient concerns, what are they anxious about, what are the worries? So here you have two bullet points which are not being tested. These bullet points can also be very helpful because they help you keep have attention to what is being discussed and keep track of the whole conversation. So attending beach party, so probably here in this part of the conversation he might describe that how he has to attend a beach party and how the appearance of the rash may be affecting him, and possibility of rash. So he's concerned about what may happen in future, right? So here it could be a kind of complication that we are looking for, and half word is already given, possibility of rash next. So here it is going to be a verb, what would happen with the rash, or so it could be the rash worsening, it could be the rash uh, you know spreading to the other body part. So what would happen with the rash? That's something which you have to look for. Then for the next heading says allergy history. So that means all these three bullet points are about the allergy. Now we can see that again the words in bracket give you some hint. This kind of questions can be tricky because it's very easy in this kind of questions to miss the order of the answer. Like sometimes you may write the answer of something else in the sixth, and then you may end up writing answer of seventh in the sixth. Those kind of things can happen. So the words in the bracket can help you make sure that you are writing the correct answer. So all three are going to be about allergy, but this allergy they have since age 13. So this is going to be a substance, the substance to which they might be allergic. Then as a child, now resolved. So this is very, very important keyword. They do not have this allergy now, it has resolved. And can anyone say what is meant by headaches and lethargy here? It says needs to avoid something. That means again I'm going to have a substance here. But why they have written headaches and lethargy? Why headaches and lethargy? Here the words in bracket indicate since how many years they have it or since when it started. But here it says headaches and lethargy. So what is it indicating? What clue is it giving? One of the important aspects you would need to cover is that the listening part A are the notes taken by the doctor or by the nurse. So you need to understand how notes are taken. When somebody is taking notes, they would not write words like as a result, because of, it would not be, a kind of full sentence. But what they usually do is, if they want to indicate as a result, they would just put an arrow, right? So here also it is indicating something similar to that. They need to avoid something, and if they don't avoid it, or if they take it, it leads to headaches and lethargy. So the patient may not tell you that I need to avoid something, but the patient may describe it by saying, if I eat something or if I take this, it causes headache and lethargy. So you would not keep waiting for the word needs to avoid. Okay? So this is an important keyword that you have. That's again the challenge that you have in the listening part A, that the patient may not be speaking the exact word that you have written here. He might be using something synonymous to that. Okay, last subheading is medical history. So again here as an infant is your keyword. So you are looking for again a disease condition that they had as an infant. Then again see here, take the maximum benefit of the layout. Okay? The layout here has two main bullet points. So skateboarding injuries is the main bullet point, and rest of the points are sub points. That means this all are injuries. That's an important key, isn't it? Then it says fractured blank aged 8. So aged 8 is my keyword here. What type of word am I looking for? Fractured something. That means this has to be a body organ that they fractured or a bone that they fractured. Then blank fracture to elbow. So now body organ is given, but blank fracture. So here I'm looking for type of fracture, and I also start thinking about different types of fractures. Okay, as a nurse, I'm familiar with the types of fractures, so I start thinking about it. then fractured 2 fingers, this bullet point is not being assessed. So you don't need to write this 2 fingers here because elbow is given already. And blank to leg. So here also you have 2 keywords. Leg and aged 16. So something that happened at the age of 16 and it happened to their leg. So here I'm looking for type of injury because the main heading says skateboarding injuries. Right? So this is what I have to do pre-listening and see. When we do it, it may take us 10 minutes time in the beginning, but in exam I'm going to get 30 to 40 seconds. And that's the main reason why you need to practice a lot from beginners and intermediate to improve your prediction skills. Okay? And if you are able to predict well, it would be much more easier for you to pick up the answer when the audio starts because the entire 5-minute conversation would say involve around 700 to 800 words. Out of that, you just have to pick up those 12 words. So how do you pick up them? Again, because you are not going to, read or you're not going to listen to the similar words like appearance or number of. Okay? As an infant, they wouldn't use this kind of words, needs to avoid. So it is something that patients would be speaking in their own language. Right? So what I'm going to do next is I'm going to play the audio for this part of the conversation. And I want all of you to write your answers. You don't need to type in the chat box. You can just write it for yourself on a piece of paper. And then we would discuss these answers. Yeah. So I'm going to play this part now.
So, what's troubling you today, John?
I have this really weird looking rash thing on my chest. It's kind of below my collarbone and it's become really itchy over the last day. It's really bad at the moment actually and I can't stop scratching it. I mean I'm trying but it's too hard and it looks all kind of scaly and pink. It's pretty weird. And then yesterday morning after my shower, I noticed there's a lot more of these little spots coming up around it. There'd only been a few up until then. It's definitely getting worse, look.
Okay. Well, that looks like what we call pityriasis rosea. A fancy name for a rash, really. It's common for your age group. Have you been ill at all recently?
I had a bit of a cold for a few days last week. Just a runny nose, sneezing, that kind of thing. I'm fine now, though. About 3 weeks back, I had a really bad nosebleed, and my mum took me to emergency, and it ended up being nothing.
Having a cold right prior to an outbreak is quite common, too. The rash usually clears up by itself after a couple of months and rarely reappears, but you'll need to avoid excessive sun and regularly apply generous amounts of moisturiser.
But I have a beach party this weekend at my mate's holiday house. If I can't be out in the sun, then there's no point going. I mean, it's actually his 18th, and he's my best mate. Also, this looks pretty disgusting, and there'll be lots of people there. Isn't there something I can take to help clear it up, or at least stop it from spreading more? Because if that happens, by the weekend it could cover my whole body.
Oh, that won't happen, I can assure you. But you will have to keep your shirt on for the hottest part of the day. Do you have any allergies, John?
Yeah, I've been allergic to dust mites since I was about 13, I think, so my mum's always cleaning. My skin usually just gets really itchy, and I sneeze like mad. When I was really young, I was allergic to milk, but I'm over that now. The only other thing I have to keep away from is that stuff they put in cheap takeaway food to make it taste nicer. Oh, what's it called? Oh, MSG, that's it. That stuff gives me shocking headaches, makes me so tired that I can't do anything for about a day.
How about medical history? Have you ever had any major illnesses or operations?
I had chickenpox when I was a toddler, but I've also had to go to hospital 4 times for things. I've been a skateboarder since I was 6, so I've had a few spills. I broke my left wrist when I was about 8 years old, skating off a quarter pipe. That was a pretty bad one, but I made it over 5 of my friends who were all lined up on the ground. Then later, I'm not sure how old I was, maybe 11, I had one of those really small breaks, like a hairline fracture in my elbow. I also broke 2 of my fingers on my right hand. I had to have them strapped up. That was a pain. And then my last one was last year, and was probably the worst because it was so painful. It made the other ones seem like a joke. I had to go into emergency because of some pretty serious grazing along my leg. I came off my board going down a hill on the side of this really rough road. It had dirt all in the wound. They just washed it out and put bandages all up my leg, but I was in agony.
Well, hopefully that'll be the last of your injuries, so...
Okay, so I hope all of you were able to write all the answers. Can you just type in the chat box if you have missed any of them? Can you just tell me how many have you missed, if at all you missed any one of them? You missed 2, Pankti. Okay. How about you, Praful? Were you able to do this? Have you answered all the questions? Please type in the chat box for me. How many have you missed? Okay, you couldn't see first blank, is it? Yeah, true. Here there is this print error, so probably you couldn't see that. You missed some? Okay, yeah. So now I'll bring the answer page on screen. You need to compare your answers with this one, and then we would discuss the answers. Okay, so I've got the answers here. Yeah, even in prediction, we missed out the first one. So that was just after rash on chest, exactly where the rash is. That was the question. So that's okay if you have missed this collarbone or clavicle. Then appearance of the rash we had predicted. So it is scaly and pink, or pink and scaly, both are acceptable. Then we were looking for increase in something, right? So he explained that, there are a lot of spots coming up, he said. Obviously, he did not use the exact word increase. Then nosebleed, spreading. We were expecting a verb there for rash, so that's spreading. Then a substance that can cause allergy, so that is dust mites, milk, and MSG. MSG is a type of flavor enhancer, kind of ingredient that is used in food products to enhance the flavor. It is a chemical, monosodium glutamate, and the short form of it is MSG. Then chicken pox, we were looking for a body part, left wrist, then hairline fracture and grazing. We were looking for type of injury. Right? So our prediction was pretty close. So I hope all of you were able to get the correct answer. Now let me know which answers are wrong for you. If at all you have got any of the wrong answers, then please type in which answers were wrong for you so that I can help you out. The words that are there in the blank bracket are optional. Right? So if you just write sports, it is correct. If you write little sports, then also it is correct. 2, 5, 8, and 12. Okay, so 8 is, yeah, probably. What did you guys write here in 8? Did you write cheap food? But see, when a person is allergic, we were looking for a specific substance. Yeah, so that is cheap. Cheap was here used as something which is not costly. It is not a substance. Cheap, they said. Cheap. It was not chip. So being familiar with the sounds can help you. It was not chip. It was cheap. That means something which is less costly. But that is not a substance. Then they said food products. So food products is also not a substance. Then he said, what is it called? Then he explained MSG. So that is why 8 is MSG. Then for the second one, what have you written in the second one? We were looking for an adjective for rash. Adjective for rash. So that's scaly and pink. Weird was already given there. Then fifth, spreading. 12th. Okay. What have you written in 12th Pankti? Wound. Okay. Now wound will not be considered as type of injury. We were looking for type of injury. So see, what I'm going to do next is I'll just bring on the transcript so that you can see clearly. That is the main challenge, right? The kind of language that patient uses. So being familiar with phrasal verbs can be very, very helpful. So he said, and it looks all kind of scaly and pink. It's pretty weird. So whenever a person is trying to describe something, we would usually say it looks like, isn't it? It looks like. So that's, the person would not use the word describe, but they would say it looks like. And kind of is, a very common kind of filler that native speakers would use. Sort of, kind of, that is, um, a synonymous to type of. So scaly and pink. And then he said, I noticed there is a lot more of these. So instead of saying increase number of, he said, lot more of this, little spots coming up. So they wouldn't use the exact word increase in number of, because that is the language health professional has used. And then he explained there had only been a few there had only been a few up until then. So far they were just a few, but now he explains more of this little sports. So that tells us increase in number of something. Then here, He said, I had a really bad nosebleed, right? Then here about the patient concerns. So he was explaining that, isn't there something I can take to help clear it up? So to clear it up, this is also a very commonly used phrasal verb. They would not say resolve or treat as a patient. They would say to clear up, or at least stop it from spreading more. Stop it from spreading more. So see, he did not use the word concerned about, or he did not use the word possibility of, yeah. But so this was very tricky answer to pick up, because he was talking about his concerns. So one concern he explained was that there was this beach party, and then he also explained that it looks pretty disgusting. So second bullet point was appearance of the rash. And third concern is that he wanted a treatment so that it resolves, or at least stop it from spreading more. So possibility of rash spreading. Right? Then about the allergies. So we were looking for substances. So these two substances were easy to pick up. Dust mites. So it should be dust mite. If you have written just dust, it is wrong. Dust is different and dust mites is different. Mites are kind of a very tiny, you can call it parasite or insects present in the dust. Then he talked about milk. But I'm over that now. See, again here they would not say resolve, but I'm over that now. So this is something you have to get familiar with. That is the reason why I encourage all of you to listen to consultations on YouTube, because when you would listen to consultations on YouTube, you would get familiar with the real life conversation that these native speakers have with each other. Again, he did not say, I have to avoid. He said, I have to keep away from. So to keep away from something is also to avoid something. Right? So that's the main challenge here. You will have to understand how the patient is describing, because the language that you have here in your question paper is the language used by the healthcare professional. So you have to do that matching of healthcare professional's language and the patient's language. And then he said, uh, you know, I have to keep away from that stuff they put in cheap takeaway food. But he was talking about that stuff. Now, which stuff? He was not able to remember the name, so he was thinking, and he said, what is it called? MSG. So probably you might have heard this word MSG very clearly, but you may not be clear on what to write there. So think logically. He first said that I need to keep away from that stuff. Now, stuff is a very vague word. It means some element. Now, which element? So, cheap takeaway food is not the element, because the stuff they put in, to put in means to use, isn't it? While cooking something. So, he's not allergic to cheap food, but he's allergic to a substance or an ingredient that they put in takeaway food to make it taste nicer. What is it called? MSG. So that is the reason I put a lot of emphasis on listening part A, because you can do fairly well there, but what we are aiming for is getting all the answers correct, at least not skipping any of them. Okay? You should be able to write all 24 of them. That's the main reason why we are working so hard on listening part A. And it is achievable goal. You can achieve that with appropriate practice. Okay, now about the injuries that he was describing. Right? So he started by saying that he had this, I broke my left wrist. So see, again here, he didn't use the word fracture. right? But he said broke, but that was obviously for fractured. So we got left wrist there. Then I was about 8 years old, skating off a quarter pipe. So off something means to fall down from something. Then he explained that uh, he had really small breaks, like a hairline fracture in my elbow. So hairline was type of fracture that we were looking for. And then he talked about some injuries. So here, because of some pretty serious grazing along my leg. So grazing was the answer here. What kind of injury they had? They had grazing in their leg. And this is, I had dirt all in the wound. So that wound happened because of grazing. We were looking for type of injury. Wound is not type of injury. Okay, now let us do the second one. Okay, this time make sure that you are able to pick up maximum answers. Okay, so now for the second one. This time I want you to predict. Okay? GP talking to a woman called Sarah Robertson. I have got 12 questions here. I want you to predict the type of word for each question. Take help of subheadings and see the first bullet point here says corneal aberration in left eye. So it is quite helpful, isn't it? It is straight away giving you the diagnosis for which the patient is visiting. Injury in the eye, aberration, corneal aberration in left eye. Now start predicting for each blank. So here it is opposite. In the first one, it was to what they are allergic. Here it is given, and penicillin and amoxicillin develops what, right? So here we have to find out what kind of allergic reaction that they develop. Right? So I have written, if you were not able to predict for any one of them, then I've written the possible type of words that we are looking for. Now I'm going to play this part of the audio. Listen to it carefully. Make sure this time you're not missing any of the blanks.
So, Sarah, the nurse has just informed me that you're here with a scratch on your left eye. Is that correct?
Yes, it's quite painful.
Have you taken any pain relief for it?
Not yet.
Okay. While I'm having a look, can you tell me how this happened?
Well, it was my little boy's fingernail, actually. We have a 2-year-old, and I was in the park trying to put his coat on. It happened when he pushed his hand through the sleeve. It's my fault, really, because I should have trimmed them days ago, but every time I try, he rolls his hands into a fist and refuses to let me near them.
He's definitely scratched it. It looks to me to be a minor abrasion, which is good news. I'll be able to give you some lubricating drops to keep it moist and comfortable while it heals.
Are you sure, Doctor? It feels like there's something in there. My vision is different somehow, and my eye seems to be really sensitive to light now. I had to cover it with my hand. Also, while I was in the waiting room, I noticed that it was starting to twitch, like it was trying to get something out. And now, as you can see, the tears are just pouring out.
It may feel larger than it actually is, and the symptoms you describe are quite common, even for the most superficial abrasion.
Because a similar thing happened to a friend of mine. It wasn't from her child. I think she was gardening and somehow scratched her eye. She ended up getting an ulcer. I definitely don't want something like that. And that's really worrying because she ended up losing some of her sight. It's been troubling her ever since.
Let me assure you, complications such as the one your friend experienced typically only occur when a very deep abrasion is left untreated. Do you have any history of eyesight impairment?
The funny thing is, I'm nearsighted, so I've been wearing glasses my entire adult life. I'd have had them on today, actually, if I hadn't left them at home on the coffee table. Sometimes I even wear those coloured contact lenses because, as you can probably tell, I have one green eye and one's a greyish blue. I feel a bit juvenile wearing them, but maybe if I'd been wearing those today, I'd have had at least some protection. I've been with the same optometrist for 6 years now, and I go for 6 monthly checkups.
Okay. Well, I'll prescribe you some antibiotic eye drops just to ward off any infection while your eye's on the mend. Do you have any allergies or illnesses I should know about?
I know I'm definitely allergic to penicillin and amoxicillin because the last time I had either, I broke out in a terrible case of hives all over my body. It lasted for hours. I didn't have any other symptoms, but the doctors told me to avoid anything in the penicillin family. Also, when I was 22, I went to hospital just for a gastroscopy, nothing serious. And they found that I have an allergy to latex. Their gloves caused a red rash and even some blisters around my neck.
Any medication?
Not at the moment. I was taking something for sciatica, but I haven't had any pain for a while.
Will you be needing a certificate for work?
I'm a full-time homemaker, so no certificates needed for that. The one thing I guess I'll have to hold back from, though, is my aqua aerobics class every Wednesday. Will I have to stay away from the pool, Doctor?
I'd recommend it until your eyes had a chance to fully heal, at least. Now, before I give you any other...
Okay, so this time were you all able to write all the answers? Right, so if you go with correct prediction, then it would be very much possible for you to at least get 20 correct. The score anywhere between 20 and 24 is a really good score, and it's not that difficult, believe me. It is just that you need to get familiar with how doctors write their notes, because what you have in the question paper are the notes, and what you listen to is the patient's kind of language. But the best part here is that you don't actually have to convert patient's language into something else. Probably you may need to just pick up that word. Otherwise, if you had to convert, probably it would become much more difficult. So here you had to write all these words you can actually hear in the audio. It's just that prediction helps you to decide which word is to be written as the answer.